Hi, welcome to MediQuarrier. Please don't forget to like our videos, to leave comments behind, to subscribe, to hit the notification bell, to share our videos with all that might benefit. Today we are going to proceed with our introduction to radiology. Plain radiology is a technique of medical imaging that employs X-rays to form images of body organs. The images formed in plain radiography are two-dimensional, and structures are superimposed on each other as though the body is smashed against the wall. As the X-rays pass through the body, they are attenuated or weakened to different extents by different tissues depending on the tissue density. Tissues that allow more X-rays to pass through them, the radiolucent tissues, appear darker than those that allow less X-rays to pass through them, known as the radio-opaque tissues. This is because the X-ray film contains silver, so when X-rays hit the film, it converts silver to a form that is black in color. So an area that receives more X-rays appears darker, whereas an area that receives less X-rays appears brighter. The borders of a structure are only visible if its density is different from that of the surrounding tissues, creating a natural contrast. We shall illustrate this in a moment with an example. But just to throw a little bit of light, consider an individual wearing a yellow shirt in a yellow background. Such an individual cannot be differentiated from the background. But if you're wearing a different color from your background, then you can easily be seen as a separate entity from your background. There are mainly 5 tissue densities in plain radiography. The first one is the air density. This is the darkest density since air allows almost all the X-rays to pass through, turning the film black. The second density is the fat density. This density is also dark, but it is lighter than the air density. The third density is the soft tissue density or the fluid density. This density appears a little bright since less X-rays can pass through. The fourth is the bone density. It is brighter than the soft tissue density or the fluid density. It is the brightest of all the natural densities. Lastly, we have the metal density. This is the most radio-opaque density. It is created by metallic objects like orthopedic hardware, artificial pacemakers, contrast material, among others. One needs to appreciate the gross anatomy of the region in question in order to successfully interpret plain radiographs. That is to say, you need to understand where these densities are found in the normal body. Where is it normal to find the air density, and where is it normal to find the bone density, and how should the soft tissue density appear, and so forth. Let's illustrate the concepts with an example here. This is a plain radiograph of the chest in the posterior anterior projection. One thing you'll notice here, like I said before, is that the tissues are superimposed on each other like something smashed this chest against the wall. So you cannot clearly know what is anterior and what is posterior. The other fact that you can appreciate here is that the structure is only seen if its density is different from the density of the surrounding tissues. Let's look at a few examples. Let's take the diaphragm. The outline of the diaphragm is only visible because the density above is less than its own density. Likewise, the borders of the heart, as seen here, can only be seen because the density of the heart is different from the density of the surrounding lung tissue. However, in the mediastinum here, there are a lot of structures, but you cannot demarcate their margins because all of these have the soft tissue density. For example, here is the aorta, but you cannot clearly see its outline. Now let's proceed to illustrate some of the densities that we can appreciate here. The first density here is the air density. This is the air outside the patient. It is the darkest density. Also seen here is still the air density, but it is not as radiolucent as the air surrounding the individual because there are other structures superimposed on this, and therefore what you get is a resultant density, which is a combination of all the tissues that the x-rays have had to pass through. There is another air density here, which is not as dark as the rest, or not as radiolucent as the rest. This is because of the superimposed soft tissues that add a little bit of radio opacity to it. This is the air bubble of the stomach. The second density that we can see here is the fat density, just adjacent to the air surrounding the individual. This is subcutaneous fat. It is dark but not as dark as the air density. The third density is the soft tissue density. Outside the rib cage, this density is due to the muscles. In the middle of this plain radiograph is mainly due to the heart and other tissues of the mediastinum. And the fourth density here is the bone density. Where the figure 4 appears is the clavicle of the patient. Now let's move on to talk about the applications of plain radiography. Plain radiography is used in the assessment of bones for fractures, infections, and other lesions. It is also useful for the assessment of the abdomen for different pathologies such as intestinal obstruction, gut perforation, tumors, and so forth. It is also used in the assessment of the chest for different lesions, be it lesions of the lungs, abnormalities in the pleural cavity, lesions of the heart, and so forth. It is also used in the assessment of breasts, especially for breast cancer. It is also used in the assessment of skull bones, for fractures, for abnormalities of the pituitary fossa, among others. It is also used in the assessment of teeth in dentistry, and also for identification of individuals using their dentation. The contrast between structures can be improved by administration of an artificial contrast medium. These contrast media vary. We shall discuss this contrast media in a separate video. Now, let's talk a little bit about fluoroscopy. Fluoroscopy is more or less like plain radiography. The only difference being that fluoroscopy forms two-dimensional images in real time. In other words, fluoroscopy is like an X-ray movie. The activity of the moving structures can be visualized through this procedure. For example, movements of the GIT, respiratory movements, among others. The moving pictures are displayed on a screen like an X-ray movie, like I said before. Thank you very much for watching till the end. Please help my channel grow by liking the videos, commenting on them, subscribing to the channel, turning on your notification bell, and sharing with your friends. See you in the next video.